Hello, my name is Kyler Ruloff, and I'm here to talk to you about drugs. Drugs are bad. Don't do them. We're going to talk about stimulants. Today we're going to talk about some caffeine. It's not good for you. You may think it is. Just because it's legal doesn't mean it's good. Let's start talking. This is a typical caffeine addict. Caffeine can cause restlessness, nervousness,
Skyler, you want a cookie?
excitement,
Come get it, Skyler!
cookie, yeah. Insomnia, flushed face, Darishis, gastrointestinal disturbance, muscle twitching, rumbling flow of thought and speech, tachycardia or cardiac arrhythmia, periods of inexhaustibility, psychomotor agitation. Now I want to talk to you about cocaine, or coke, or cane, or as some call it, Cocoa Puffs. This is a typical cocaine addict. Cocaine overdose can cause dangerous or fatal rise in body temperature, seizures, heart attack,
Oh no!
brain hemorrhage,
Oh,
kidney failure, stroke, repeated convulsions, tremors, delirium, or death. I want to talk to you about hallucinogens today and how they are bad for you. I want to talk to you about lysergic acid diethylamide, also called LSD. This is a typical LSD user. When you use LSD, the following may happen:
I mean, only prescription.
hypothermia, fever, elevated levels of blood sugar, goosebumps,
Do you really?
decrease in heart rate, jaw clenching, perspiration, pupil dilation, saliva production, mucus production, sleeplessness.
I cannot fall asleep tonight.
Why not?
That's a monster.
Oh.
Hyperreflexia, and tremors. Now we need to talk about PSP, also called PCP. This is a typical PCP user. PCP will cause staggering, unsteady gait, slurred speech, bloodshot eyes, loss of balance, and convulsions. We need to talk about depressants. Alcohol is bad. Alcohol can be split into 6 different levels of alcoholizing. The first section that we will talk about is euphoria. Euphoria is when your blood alcohol content is 0.03% to 0.12%. The next step is lethargy. Lethargy involves people that have a blood alcohol content level of 0.09% to 0.25%.
That's crazy.
The next step is confusion. Blood alcohol content level of 0.18% to 0.30%. Stupor. Blood alcohol content level of 0.25% to 0.40%. Coma. It's bad. Blood alcohol content level of 0.35% to 0.50%. Death. Blood alcohol content level of 0.50% and up. The next drug I want to talk to you about is purple drank. This is a typical purple drank user. When you use this drug, you will get a euphoria.
You're not very
itching.
Ooh, that's itchy. What about your hair? You look crazy. You're a tiger. You're Tony the Tiger. You're a bear. You're a giraffe. You're a dinosaur. You're Tony the Tiger pretending he's a dinosaur. Yeah.
My tummy hurts.
Nausea.
I'm going to throw up.
Vomiting.
I'm very
Drowsiness.
tired.
Dry mouth. Hemolysis.
I hate
Orthostatic
everything.
hypotension.
I have to
Urinary retention. Depression. And constipation.
We're going to talk about narcotics now. And to start off, let's talk about heroin. This is a typical heroin addict. Some of the effects from heroin include slowed and slurred speech,
Story of my life.
constricted pupils, droopy eyelids, impaired night vision, vomiting, and constipation.
Yeah.
Some long-term effects
I need to poop.
include collapsed veins, infection of the heart lining and valves, and liver disease.
Story of my life.
Opium is dopium. This is a typical opium addict.
Left-handed.
Some
3,
effects
2,
of
1.
opium include sense of emotional detachment,
absence of
I'm
pain and
very
stress, altered mood and mental processes,
I'm going to
sleepiness, vomiting, loss of appetite, reduced sex drive,
I am
itchy
not
skin,
hungry right now.
increased urination,
I have
sweating,
to pee a lot.
inability to concentrate,
I cannot see.
impaired vision, and death.
Now I want to talk about inhalants.
This is a typical inhalant addict.
I have a headache.
The side effects of inhalants
You've been doing
include headaches,
I'm going to swallow.
nausea, vomiting, loss of balance, dizziness, slurred and slow speech, mood changes, hallucinations, loss of concentration, short-term memory loss, hearing loss, muscle spasms, permanent brain damage, and death.
I want to talk to you about cannabis, and specifically marijuana or marijuana.
This is a typical
What are you smoking, Skylar?
marijuana addict. Some of the effects of marijuana include enhanced cancer risk, sleepiness, difficult keeping track of time, impaired or reduced short-term memory, reduced ability to perform tasks requiring concentration and coordination, increased heart rate, bloodshot eyes, dry mouth and throat, increased social inhibition, paranoia, intense anxiety or panic attacks.
Now I want to talk to you about anabolic steroids.
I just took a lot of steroids and now I'm ready to work out. This is a typical steroid user. Some of the effects of steroids include baldness, male development of breasts, reduced sexual function, female increase in body hair, deepening of the voice. When taken during pregnancy, can affect fetal development. When adolescents take steroids, it can result in stunted growth.
Laxatives. That's what I want to talk about.
This is a common laxative user. Laxative can cause intestinal paralysis, irritable bowel syndrome, pancreatitis, renal failure, and can cause dehydration and extended diarrhea. If you find a person that is unconscious due to an overdose, you should do the unconscious victim check. First, check your surroundings to make sure they're safe. After all, if the person is overdosed on certain drugs, there could be needles around. After that, you should shake the person and ask if they are okay to see if they are asleep or unconscious. If they do not wake up, you should tell someone to call 911 because of an unconscious victim. Then, listen if they're breathing and look down their back to see if there's any movement. Flip them over and listen for breathing after you do the head tilt chin lift. Then give them 2 rescue breaths and then find the pulse right by the Adam's apple and check the pulse. While checking the pulse, look on the body for any cuts or bruises.